we're very excited to launch our new expert webinar series, which we call, it's a part of our X equals experience group of events. We have named this Reimagine Tomorrow. And I have tremendous pleasure in welcoming my good friend and a very eminent professor from NYU Stern, Anindya Ghose. And he'll be presenting on leveraging AI, data, and the tech platforms to understand the health pandemics. Before I start, we have a lot of folks joining, and I really wanted to do a very quick introduction of our company, NetElixir. We are one of the leading independent digital marketing firms, essentially primarily in the US, and we have some amount of business in Europe, Latin America, and Asia Pacific as well. We are a premier Google partner, Bing partner, and a UPS Ready partner, and work with a fairly wide range of clients. All of our clients happen to be from the retail industry, and offer them a wide range of digital marketing solutions, starting from advertising on Google and Bing, which is called paid search engine optimization, social media marketing, Amazon marketing services, analytics consulting, and e-commerce technology development, or website development as well. So some of you maybe have asked me as to why are we doing a digital marketing firm really doing a series like this? Well, I guess as we all navigate through these rather uncertain times together, I think we need more than just real data. And we have been, I mean, those of you who have been joining us for our fairly regular, the impact of COVID-19 on e-commerce sales and shopper behavior webinars that we have been doing, they would know that we have been relying a lot of real data that we have been sharing since the 11th of March. But just other than the data, we need a lot of knowledge, which really inspires us to look towards the future. We really rely heavily on thought leadership experience, which really is able to spark fresh ideas, give us a broader sense of the world, a broader world view, and obviously sort of brings in a lot of dollops of genius and inspiration to really help us connect the dots. Because the pandemic that we are in, and I think all of you would agree with me when I say that the pandemic we are in, it requires a hugely broader perspective of the entire world. It requires all of us to connect the dots so that we are able to form our own conception of the future, which is almost essential in terms of our building any business plan, personal plan, any plan at all to move forward. So this webinar series, we are more than happy to really introduce some amazing speakers, starting with Anindya today. And the idea is to help us get thinking about tomorrow through innovative thought leaders sharing their experiences, their research insights. And we firmly believe that this entire thing would be a spark for us to really begin to believe that we'll get through this and we'll have an improved tomorrow when we do. So that's where I think the entire aspiration and the goal of why a digital marketing firm is hosting a series like this. This would be essentially being done on a monthly basis, with the first one being today. That's the aspiration. It's just more of the inspiration plus ideas backed by research, which is required along with real data, so that we are able to form our own conception of the future by connecting the dots. That's the purpose of Reimagine Tomorrow series. With that, I mean, I also wanted to, before I introduce Anindya, wanted to also invite all of the attendees on this webinar to our two upcoming events as well, or webinars as well, on the same talk series. The first one is on June 4th. We have Professor Jerry Wind of Wharton, who is going to be presenting. The theme of his presentation is the opportunities in the time of crisis. Jerry and Anindya, incidentally, delivered fantastic presentations at our annual event, the X equals experience, last year in the month of September. And we, in the month of July, are privileged to have Professor George Day, again from Wharton, who will be presenting on how vigilant organizations are really gaining an edge during these uncertain times as well. So don't miss that. If you really want to sign up, you can use the link netelixir.com/experience. And if you are interested in sharing the love, which we would really appreciate, because the more the people are informed of all these fantastic sharings by these thought leaders, the better it is for everyone. So when you when you really sort of tweet, blog, or do any social media shares, please share the love along with the hashtag knowledge inspires. With that, let me quickly jump to the main theme and main topic. I know many of you are joining. I saw some folks joining us from UK. Hello to the team from UMD. We have obviously the big NYU Stern team joining in. We have a lot of UPS friends joining. We have a lot of folks from Missouri, California, everywhere. Such. Hello, a big hello from all of us to all of you. I have tremendous pleasure in introducing to you today's speaker, Anindya Ghose. He is the Heinz Reel Chair Professor of Business and Director of the Masters of Business Analytics program at NYU Stern School of Business. Anindya is, he wrote a fantastic book in 2017, which I personally recommend to everyone that I meet. It's called TAP, Unlocking the Mobile Economy. It has been a best-selling double winner of the 2018 Axiom Business Book Awards. And last year, I think probably his most famous sort of claim to fame, Anindya, and correct me if I'm wrong, is he delivered an amazing presentation at our X-Equals experience, which was titled The Rethinking Innovation. So with that, let me welcome Anindya Ghose. Anindya, off to you. I'll stop sharing, and if you can share your screen, that will be great. And we'll try to do it as more of a Q&A plus presentation series as well. So I'll be asking questions, and I request any questions that you may have for Anindya, just feel free to essentially ping in directly there. But Anindya, off to you. Thank you.
Thank you, Udayan. Thanks for having me. I'm absolutely delighted to be here and share with you some of my thoughts on how countries around the world have been using technology and AI and data science to figure out this entire health epidemic. Okay. So let me sort of kick it out by giving you a sense for the roadmap. The agenda is as follows. The first few minutes, I'm going to talk about how tech and data were used in the early days of COVID-19. And give you a couple of different examples from different parts of the world. Then I'll jump right into some recent research that a cross-university team from NYU, CMU, and the University of Virginia has been doing. I'll share some insights from what we're finding. Next, then I'll move on to some of the lessons that we've learned from some pretty amazing work from the epidemiologists and the virologists. And I'll only sort of highlight those lessons that are relevant, to the next topic in the agenda, which is, should we open the economy? And if so, how should we open that? And then I'll conclude by talking about, this long-lasting issue of how will the world of data and privacy look after all of this is, hopefully over sometime later, okay? So let me tell you a little bit of an interesting story. On December 30, 2019, just a little after midnight, a Canadian AI platform called BlueDot picked up a cluster of unusual pneumonia cases happening around a market in Wuhan, China. Okay? So as it turns out, BlueDot had spotted what would come to be known as COVID-19 9 days before the World Health Organization released its statement alerting people to the emergence of this virus. Now, how did BlueDot figure this out? Well, BlueDot used natural language processing and machine learning to cull data from hundreds of thousands of sources, including statements from public health organizations, social media, global airline ticketing data, livestock health reports, and other kinds of population demographics. And in fact, their predictive accuracy was so remarkable that BlueDot was also able to correctly identify the cities that were highly connected to Wuhan using things like global airline ticketing data. And this helped them anticipate the next set of cities where this outbreak would unfold. And in the end, it turns out like 11 of the cities that they had predicted using machine learning, big data, actually ended up being exactly what they were in terms of the next set of outbreaks. Okay, so it's remarkable accuracy, right? We also have other examples like Google's DeepMind. We know that proteins do the vast amount of work of organisms, and that's why it's really important to understand the three-dimensional shape of proteins, because that would then help, give some color on the kinds of vaccine that we actually need. So as it turns out, Google's DeepMind unit offered some of its data files to figure out the structure of some of the proteins that may be implicated in this virus, okay? We had other examples of Baidu in China using computer vision and infrared sensors to be able to predict people's temperature in public areas. And the system could screen up to 200 people per minute and detect their fever within a 0.5 degrees Celsius. Okay? Next, let's talk a little bit about some ways in which technology was used to empower consumers, right? Now, you might recall, some of you may have read that Alibaba and Tencent pioneered a color-based QR coding system for tracking individuals affected with coronavirus. So if you get a red code on your QR code, you get quarantined for 14 days. If it's yellow, you get quarantined for 7 days. This was widely deployed at travel checkpoints at airports, train stations, highways, customs and immigration checkpoints. Okay? The government also launched an app known as the Close Contact Detector, which lets people know whether they are at risk of catching this COVID from somebody else in close proximity. In Taiwan, a very pioneering entrepreneur worked with the government to develop something called the face mask app, which basically provides real-time location-specific data to the public on the availability of masks. So, if you're in a zip code, you don't have to worry about looking around like which stores have the mask. You can get it right away on that app, if they have the inventory or not. Another amazing example of how mobile apps are used for consumer empowerment comes from Singapore, where they use something called the Trace Together app, which allows users who have contracted the disease to share the information with other potentially infected individuals. Okay? And then, of course, we have robots who are performing contactless delivery inside hospitals. They're delivering food and medicines to patients, disinfecting their rooms, all sorts of stuff, right? So some pretty amazing examples of how data and technology was used. Let me sort of now give you sort of a broader overview of how data science modeling has been used in this health pandemic. Now, if you've been interested in this space, you know that in the past, scientists have used aggregate measures like Google flu trends and Twitter, but it was found to miss early waves of the 2009 H1N1 pandemic. Okay? The challenge with using these aggregate methods like Google flu trends or Twitter is it's really difficult, if not impossible, to distinguish between activity that is related to an individual's own illness and those related to the heightened media awareness and interest about influenza during the flu season. Okay? So because of this, epidemiologists and virologists and social scientists realize you actually need much more enhanced tools than the traditional surveillance methods. Okay? So at this point in time, we have two broad-based data science methods. The first is what we call shelter-in-place analysis or social distancing analysis. This is very aggregate. This is not looking at individual user-level behavior. It's saying, hey, what fraction of people in a given city are actually complying with the social distancing measures, okay? We saw this in Europe. The telecom carriers in Germany, in Austria, in Italy, in Spain, they shared this data with health authorities. In one particular example was, in Italy, people were puzzled by the high fatality rates compared to the rest of the world. And, some said, hey, it must be the a significant fraction of elderly population, maybe it's the high fraction of people who smoke. But turns out the single biggest reason for the extremely high fatality rates in the early days in Italy and Spain was people were not complying with social distancing. How do we know this? We know this from their mobile phone data. And in fact, in Milan, for example, 40% of residents were moving around beyond a 300 to 500 meter range from their home, despite the lockdown. Okay? Now, in contrast to this aggregate analysis, another set of modeling methods that is in play here is something called active contact tracing and quarantine enforcement. Okay? So active contact tracing essentially uses individual user level data to be able to figure out, who are the different individuals that a given user has been in touch with before he or she got infected. Okay? This involves the use of geolocation data from smartphones, CCTV surveillance, GPS data from cars, offline credit card transactions, et cetera, et cetera. Now, successful use cases of this have been used in Taiwan, China, Singapore, and so on. So why this took off is in the past, between 2003 and 2012, right, when we had these prior pandemics like H1N1 or MERS, the level of accuracy of location data was quite abysmal, to be blunt. Okay? The level of sophistication of technologies for tracking was very basic. Things are very different in 2020. In 2020, it is now possible to identify the location of a given user within 1 meter of where they are with 91% accuracy. Okay? We also know from COVID-19's initial set of human-to-human transmission that anybody who comes into contact with an infected user within 1 meter of where they are, roughly 3 to 5 feet, and stays in contact for more than 15 minutes can get infected. So, Udayan was kind enough to give a shout out to the book that I'd written a few years back. That book essentially captured some of the work that my co-authors and I've done with telecom providers and platforms and wearable tech companies. And we essentially use these sorts of highly granular atomic location data. Okay, and in case you are interested in a particular paper, you can see the recent paper co-authored with Professor Bebe Lee at Carnegie Mellon and Professor Siwan Liu at Penn State that appeared in Management Science recently, where we actually showed some of the machine learning-based techniques on how to use very fine-grained atomic data to map the user's trajectory in real time, which is then eventually very helpful for contact tracing. Okay.
So before you go in, I just have a couple of questions. And
sure.
Again, the audience, if you have questions, I'm sorry to sort of pause or interrupt in this case, but we really want to make it very interactive as well. So one question which I have, Anindya, is currently with all the data science advances and all the AI technology, are we, so we obviously are pretty strong in terms of tracing an incident, but is there any indication that anyone is making progress in terms of predicting the future or predicting as to how this would spread or the future as well?
Yes, to a large extent, the initial example that I mentioned from BlueDot, where they use global airline ticketing data to predict the next set of cities that would get affected after Wuhan, that's an example. But there's also, far more sort of granular, examples of prediction that come from a combination of epidemiology and social sciences. So on an average, you would see that the level of sophistication in modeling in the social sciences and business schools or computer science or in economics, for example, right? It's an occupational hazard, right? We have to be at the leading edge, but we don't have the domain expertise that virologists or epidemiologists have. So it's a combination of the two that helps us propel forward.
I see. I think some of you may not have heard my question as well. So let me repeat that. My question was, with all the advances in AI and data science, we seem to have made a lot of progress in terms of tracing the incidents. But where are we in terms of predicting basically the future? I mean, as to how this particular infection would spread and so on.
Right.
So that was the question which Anindya was sort of responding to. Thank you, Anindya. Thanks a lot.
Sure. And I'll talk a little more about this, some of the predictions that we can come with sufficient caveats with respect to, should we open the economy? Okay. So let me now next move on to some recent research that we've been doing with, this cross-university team that I mentioned between NYU, CMU, and University of Virginia. So my co-authors and I, Bebe Lee, Meghna Macha, Chinshua Sun, and Natasha Fouts, we've started working on what we are very excited about, a fascinating project that is looking at, did consumers sacrifice their privacy when it comes to COVID-19 by allowing contact tracing, by allowing location tracking, okay? So what you see on the screen here is sort of a high-level overview of an example of 5 different individuals. By getting their mobile trajectory data, we can see what their movements have been like, okay? So you see some users are in pink, some in purple, one is in green, one is in blue. These are 5 unique users, and it's all because of their mobile phone usage. We are able to ascertain their movements, okay? So in this research, we analyze a very atomic individual user level data set with more than 11 billion records that we draw from several blue states and several red states. So the blue are majority Democrat, the red are majority Republican. And we present some of the first evidence of how Americans responded to this increasing privacy concern that the government authorities and the private sector and health authorities may have to use individual level location data from smartphones for digital contact tracing, okay? So overall, just to sort of give you the summary of the results, while we find that people were willing to trade their privacy for the greater social good, they did exhibit a divergence in the extent of this trade-off along the lines of political divide and social distancing compliance and demographics, okay? So let me show you a picture first, right? What you see over here is saying the first picture on the left tells us how Americans did not stay at home even as the virus spread through March. So stay-at-home orders were halted, they were supposed to have nearly halted travel for most of us here in the US, but you will see that people in Florida, in the Southeast and other parts of the country that were waiting for some of the local governor enacted close-downs, they continue to travel widely. And this is part of the reason why a lot more people were exposed. You will see that the divide in travel patterns based on anonymous cell phone data. And the picture on the right tells you, how long it took before people really started to halt their travel below the 2 miles, okay? And again, in green, you see a lot of people who had stopped traveling by March 16. In light green, by March 19th. In yellow, it took till about March 26th. And finally, the ones in the red are areas where people didn't stop their traveling even by March 26th. Okay? And clearly, not everybody behaved, right? So about a half a dozen of the most popular counties we saw, for example, in Florida, people were still traveling in Jacksonville and Tampa, Daytona Beach, et cetera, okay? Okay, so what do we see over here? This graph tells you, how based on the political beliefs, okay, so again, the color coding is blue if you're a Democratic majority city and red if you're a Republican majority city. So the question we're asking is, did America unite in trading privacy for the greater social good? And the answer we find is yes, that's the good news. The vast majority of people, what you see over here, the dotted line, this is the national emergency declaration by President Trump on March 13th, okay? On the y-axis, you see the proportion of people who are opting out of location tracking by turning off location tracking on their smartphones. So you'll see that on an average, before March 13, a lot more people, right, roughly 3%, 2.5% were opting out because, generally we are reticent to share our data based on demographics. But look at what happens after March 13th, and consequently, there's a far significant drop in opt-out, meaning that more and more people are willing to stay opt-in and let their location be tracked, okay? The other thing you would see is while areas with more Democrats were more privacy concerned than areas with more Republicans before the COVID crisis, okay, there was a significant decrease in opt-out rates amongst both Democrats and Republicans, but slightly more amongst Republicans than among Democrats. In other words, there's a small difference, small but meaningful difference, where we see more of the blue cities decided to opt in and slightly fewer of the red cities decided to opt in, okay? So another thing that we looked at is, and these are just representative examples of 10 cities. You got Baltimore, DC, Boston, New Orleans, San Francisco. You got Jacksonville, Lexington, Omaha, Colorado Springs, and Virginia Beach. So what are we looking here? What are we looking here is how did the extent of social distancing, okay, influence your propensity to share your location tracking data? So what you see is as you go from 1 to 5, okay, essentially from left to right, there is more contact with other people. There's less social distancing. So in other words, the purple pink line that you see on the top, that means you on an average, you're getting in touch with at least, let's say, a dozen people every day, despite the advent of the virus. Whereas if you are in the red curve, you're essentially just staying locked in. Okay? So you see that, again, after March 13, there is a dramatic drop in the number of people that you come in contact with, okay? But of the ones who are opting out of the location tracking, they are the ones who are doing less social distancing, okay? So the less you socially distance, the more you are actually likely to opt out, because for various reasons, one of which is you don't want to be tracked and monitored because you are actually not complying with the laws, right? So you see this pattern is consistent across red and blue cities, but there are obviously differences. Some cities like San Francisco, there was already significant levels of social distancing happening even before the crisis. Okay. So again, this is all just to give you an overview of how people were behaving. Like I said, we do find on an average that people are more likely to opt in after the crisis, but there's a difference between red and blue cities. In addition, we find that people who practice social distancing, like traveling less and interacting with fewer people, they are less likely to opt out. They want to stay opt in because they're complying with social distancing. So, we are excited with this work because we believe that this work makes a contribution to understanding how, the pro-social behavior manifested itself during this crisis. I think so. It's one of the positive things in the crisis. It seems like more and more people are willing to sacrifice a tad bit of their privacy for the greater social good. Okay, so let's take a look at some other examples. Right. What happened in Florida during spring break? You see this orange cluster over here. These are all, beachgoers assembling on a beach in Fort Lauderdale. And guess what happened? Well, once spring break ended, they essentially took the virus and spread all over the rest of the country, at least significant parts of the east and the northeast. Right. And this kind of data, again, helps us, do a quick assessment of the probability of exposure to the clusters. It helps us stop the transmission chains and so on, okay? What about New York versus Washington State, right? So remember, the first known case of this crisis in the US came from Washington State. But as the virus spread, you see that the vast majority, overwhelming majority of the virus cases actually came out of New York City. This is an example, again, where had we stopped intrastate travel, we probably and almost certainly would not have seen this level of spread. Okay? The ones in red are all cases coming out of New York City. The ones in yellow are all cases coming out of Washington State. And you'll see that even in the west part of the country, the Midwestern states, the southern states, you see that the vast majority of cases are coming from New York. Okay? So these are all examples, of how mobile location data combined with other sources can help shed some very valuable light on how this crisis unfolded in the country. Okay?
So Anindya, I have just a couple of questions.
Sure.
Sorry to interrupt.
Sure.
Again,
No, please.
The audience, please feel to ask any questions through the chat and the Q&A. Okay, a couple of questions. So I think the correlation that you are trying to derive between the location tracking, the decrease in the opt-out percentages, which means that people are more willing to share the data, may that have happened because after the lockdown, probably you had a lot fewer stores open, which probably are much more distributed. So if I'm really searching for maybe the next place where I can, maybe a restaurant is open, maybe a grocery chain is open, may that be a reason which is caused by scarcity essentially rather than essentially a desire to share the data? I mean, what is your thought?
So so we actually looked at the opt-in rates and the opt-out rates of the app users, right, like before and after, and we looked for any pre-existing trends, like you were saying. If your hypothesis is true, then some of that will be reflected in a pre-existing trend, and we actually didn't find these trends. Mm-hmm. In addition, we have a very wide category of apps, so it's not just grocery apps or restaurant apps or retail apps. We have weather, social media, streaming, productivity. We have like 400 different apps, right? Mm-hmm. So it's very, very uniform across that.
I see. My second question would be, again, any questions, please feel free to sort of use the Q&A bar to add your questions as well. My second question to you, Anindya, would be, I mean, on the Florida, the spring break data that you showed, is there a particular timeline within which the entire map got covered on the Northeast because of these people, essentially the diffusion effect of these folks sort of just going down? What is the time frame?
From what I recall, this was roughly about a 10-day period. So spring break is about a week, right? This was mid-March or so. And the spread of the virus from Florida, at least the ones that can be attributed to the spring break outbreak, is about 10 to 12 days, which is consistent with the general gestation period. Correct.
Perfect. Thank you.
Okay, so I want to talk next about lessons from epidemiology. Okay, so look, there are three reasons why a number of cases remain undetected. A, you're asymptomatic. Okay, 52 to 86% of cases are asymptomatic. B, you have limited testing, and C, you have restricted testing criteria. Okay, so you've seen asymptomatic cases being a big driver of this spread on Diamond Princess cruise in Italy, in China, and many other parts of the world. Okay. Second, I want to mention a very interesting study that was done in Germany. Okay, so what happened in Germany was data on the viral load from 3,712 COVID patients was analyzed to examine the relationship between age of the patient and the viral load. And guess what you see? Okay, across ages, on the x-axis, you have the different age groups and the number of respondents. Okay. In particular, these data show that viral loads in the very young do not differ so much from those of the adults. Okay, based on these results, we have to caution against an unlimited reopening of schools and kindergartens in the current situation. Basically, it's saying that children may be as infectious as adults. Okay? So that was a pretty eye-opening study, coming out of Germany across 3,700 patients across the age group. Another issue is a lot of people have said, look, most people dying with COVID-19 have been older with underlying long-term symptoms. And so maybe, to put it bluntly, those who are dying would have died anyway, okay? But absolutely not, turns out, and here's the data that shows another fascinating study that came out of Scotland and the UK and England, and showed that on an average, men are losing about 14 years of their life. People who've died, who are men, have lost 14 years of their life because of COVID. And people who've died who are women, they have lost up to 11 to 12 years of their life. In fact, this chart is pretty amazing. It shows you based on your pre-existing symptoms. Okay, if you have no symptoms at all and you are in the 50 to 59 age group, you would have lived another 35 years had you not died because of COVID. Okay, so you can see the breakdown between men and women. You can see the age groups, and you can see as your number of existing symptoms increase, obviously the number of years of life lost is less. But by no means there is any sort of basis for the narrative that people who are dying would have died in the next year or two or whatever anyway. Okay. So that brings me to, an interesting question, like, how should we open the economy? Look, keeping the economy closed and prolonging the economic misery is not the option forever. At some point, you have to think through this, right? On the other hand, if you open up the economy and there is a risk of the resurgence of the virus, then all the gains that we accrued over the last weeks of isolation can be undone. Okay? So again, there's been some interesting studies done in this place. The one thing that I found very useful while analyzing some of the scientific work in this is that to ask this question, that which businesses should open first, we need to figure out how to assess the risk. And one simple but fairly effective way is to think about two things. What is the probability of exposure to the virus from a given business? And what's the extent of time that a customer will be in the proximity of the business? The probability of exposure to virus is a combination of the frequency with which you visit and the level of contact. Okay? Look, people spend about twice as much time in electronic stores than they do in gardening stores or florist stores or lawn stores, right? People will spend 3 times as much time searching through, let's say, the racks of Salvation Army as they would do in a dollar store. Okay? So another reason for differences is how concentrated people are. The same number of customers spaced out evenly over the day poses less risk, right, than if they all arrive at the same time. Okay? So here's a study done by a team of economists led by Baker et al., and Devin Pope and Sendil Molaidadhan, and so on. Even within the same sector, look at sit-down restaurants. And I'll show you another study from Asia that showed that sit-down restaurants are one of the biggest super spreaders, okay, of the virus. The existence of super spreader means that most of the disease spreading risk is in the economy is concentrated in a small portion of it, which means that we can actually resume some economic activity with some minimal risk. Okay. This was this brilliant study done by Lu et al. And what this is showing is that this is a restaurant, okay? The infected person is A1. A1 is the infected person. A1 sat at a table and had dinner with 9 friends. The dinner took about an hour and a half. During this meal, the A1, who's an asymptomatic carrier, released low levels of virus into the air from their breathing. And then the air conditioner's airflow from the restaurant's various vents was from right to left. Okay, so approximately 50% of the infected patients' table became sick over the next 7 days, and 75% of the people on the adjacent tables, okay, became sick over the next 2 to 3 days. Okay, the reason this happens is the way COVID is showing up in these recirculated air streams is when you breathe, when you speak, when you sneeze, and when you cough, they all dissipate different levels of droplets, some of which can get aerosolized or some of which can be on surfaces. So simply a single breath, if you are infected, even though if you're asymptomatic, a single breath will release up to 5,000 droplets. A single cough will release up to 3,000 to 10,000 droplets at 50 miles an hour. A single sneeze will release 30,000 droplets up to 200 miles an hour, okay? And even speaking will increase respiratory droplets tenfold compared to breathing. So this is an example where, sit-down restaurants, right, are clearly super spreaders. What else? Well, if you think about like gyms, okay, the average visit length, as you'll see on the y-axis, is anywhere from 40 minutes to 60 minutes, okay? There's variation in the frequency with which people visit gym. There's also variation in the time, okay? And you look at fast food restaurants, well, they tend to be small and busy, like high number of weekly visits concentrated over short periods of time. Okay, so researchers have started to use some of these data, and we also have in our the privacy-based project, we have access to the points of interest. So we're investigating precisely these sort of issues to try to figure out, like what sort of businesses can we recommend, with enough caveats can we recommend that they should actually open. But at the same time, I do want to point out that, look, to make any sort of effective policy, right, we have to work with models from epidemiology. This is also something that economists recognize, we recognize ourselves as social scientists. And then second, we must account for other economic factors, because the reopening of certain businesses will create or diminish demand for others. There are spillover effects. We call these externalities, right? We can't ignore these externalities. So I think, it's important to keep in mind that, look, think about the frequency with which you would visit a place, the time that you spend in a place, even within the same industry, like I said, in the retail world, which is a very big world, the time people spend in bookstores and electronic stores or toy stores is way more than they would spend in, let's say, a florist shop or a gardening tool shop or other kinds of retail stores, okay? Secondly, the level of contact that you'll have. Look at this graph over here. If you look at parks, right, there's very little contact with parks, and it's also pretty much all outdoors, right? the more indoors you go and the more up you go and the more right you go, your contacts increases. So I would say these are the danger zones, okay? Nail salons, gyms, shopping malls, fast food, right? And these here are some in the middle, and these are relatively safe. Okay? And you see this, some of the countries that have opened up, and if you look at data coming out of China, what we are seeing is about 75% of restaurants are open, but at best they have people within 30 to 40% of the capacity, because people are avoiding sitting in. At best they are ordering in and doing sort of takeouts. Okay? We're seeing very little economic activity happening in shopping malls. That's a combination of obviously of the economic downturn, but also this risk from close contact through large amounts of people. Another interesting study done by Professor Weitz in Georgia Tech came up with this analysis, and I won't get into the details, but you will see that between a choice of a dinner party and I guess, a small concert and a hockey match, and obviously, the March Madness, the answer is very clear, okay? And we are at more than 1 million plus infections right now in the US, okay? So even if you go to a small dinner party of 10 people, there's a chance that you will catch the virus. And that increases exponentially as you start increasing the number of close contact people, from less than 1% to 6% in a wedding to 45% in a concert, and in a sort of a stadium-like setting, it's more than 99%. Okay? So, the takeaway from all of this is, look, we should obviously rely on, common sense, but these data are telling us, something that is quite insightful.
So, Anindya, a couple of questions have been very,
Sure.
very interesting, because we have a lot of businesses and so joining us today. So this data is tremendously useful. So based on this chart that you are showing, effectively, I think, is it fair to say that places like maybe shopping malls or retail store locations should probably, you don't expect too many people to go there very soon, unless and until the overall perceived safety level or an actual safety level also goes up quite substantially?
Yes, and not only that, Udayan, I think, first of all, there will be there'll continue to be a natural reduction in the number of foot traffic in these places. Okay, on an average, people are smart enough to recognize the risk. But even as things start to get more and more still normal, let's say, 2 years from now, we actually do have a vaccine and it works, you will still see natural, organic social distancing. Some institutions will actually have to enact policies. I read that educational institutions, for example, are thinking about alternating students on a weekly basis. At best, we will operate in maybe 30 to 40% capacity till a vaccine comes. And even during that time, not every person will be allowed to enter the building as frequently as they would want to, or they might want to. So I think, you will see these sort of alternative mechanisms. A recent study came out of Israel that came out in the New York Times yesterday and said, look, we should do something, what we call a 4-day work week across 2 weeks. Why so? You work for the first 4 days and then you do not show up for work for the next 10 days. Because in case you catch the virus, it should show up in majority of people within 10 days. And if it doesn't show up, then you're cleared to come after 10 days. Okay. So, to answer your question, I think we will see various mechanisms in play, and those same mechanisms may have to be enacted at the workplace, as well as sort of, in retail environments where you normally see more massive amounts of traffic.
So again, I think it's an interesting sort of a chart, this one that you're sort of sharing, Anindya. The other part is knowing that is what we are predicting things to be. I think as close to the prediction, because I think just given the situation, we really want to be sensitive to the situation and not predict anything beyond. But based on the trends now, I think it's safe to say if that is the situation, then some of these categories or industries probably become hotbeds for innovation as well. Because they have, the only way that they can survive and thrive is come up with an alternate way, right? We are already seeing in retail a tremendous amount of focus on digital transformation, right? So things like that, I think.
Exactly.
Do you agree with that? I mean, yeah.
No, absolutely. I think, necessity is the mother of invention, and, this is as big a necessity as it ever gets. And, you're exactly right. I think, we'll see various levels of digital transformation, and, we have seen, these sort of, projections where what we in the pre-COVID world might have taken us 2 years to achieve, we probably achieved in 2 months. And what would have taken us 5 years to achieve in terms of digital transformation, we'll probably have to do this in a year or even less. And I think, like coming from a background in mobile, where, you mentioned some of the work that we've done, I think mobile, online, digital, these will continue to play a big role sort of in the retail space, because, we see again data coming out of Asia that when in 2003, when SARS struck Asia, what was the one positive silver lining in all of this? The e-commerce boom. Okay, there was no e-commerce before 2003 that was meaningful. After 2003, we saw a massive boom in Asia, right? Most of the Far East. We will see, I expect to see a similar boom in some of the online retail space. And so to the extent that's possible for businesses to set up shop online or to boost their digital transformation efforts and expedite it, I think that will pay off rapidly.
There was one question which we got from one of the attendees.
Sure.
He says that vaccines are not coming in the next 1 year or so. So how do we use the available data to ensure safety in retail malls?
Yeah, it's a great question. Honestly, I can only sort of, speculate based on what we are seeing. So, look, I think some of the epidemiologists are saying it's at least 2 years away, right? I've seen, some virologists saying that it's a Hail Mary situation to expect this to come in a year. It's probably not until July 2022. I think, it's a combination to, the answer to that question, in my mind, at least, is a combination of this, right? You have to consider the frequency of visits depending on the kind of retail store that you're in or the kind of store in a shopping mall. How frequently do people visit your store? A luggage store in a shopping mall, people don't visit as frequently. And certainly now when travel is not going to be happening much in the next 2 years, that's going to drop, right? Whereas fast food, right, is probably going to see more. What is the level of contact in a fast food restaurant? When you're taking the cup of coffee from the barista, is there any human-to-human hand contact? We have to figure out a way to avoid that contact, right? And then the extent of time. How long do you linger in a fast food or a coffee place? Maybe 2 minutes, 3 minutes if it's not crowded, most, right? That's relatively safer than you're lingering around in an electronics store or a bookstore, flipping through books, people passing by you, people standing next to you, flipping through devices and books, right? So I think the way I would look at it is, and that's why I like this study by Baker et al. They give you some color on, how to avoid the super spreaders by thinking through these 3 metrics of number 1, the frequency of visits, number 2, the level of contact, and number 3, the extent of time that you have to spend inside the store. Okay.
Good stuff. Thank you, Anindya. I have one more question before we sort of move in. I know the audience questions I really want to.
Sure.
If the production reduces due to less workers in the workplace, it will have an effect on the e-commerce as well, along with the physical as well, right? So that's more of a comment, I think. As supply will be less than the increased demand, isn't it?
No, true, absolutely. I mean, look, the issue of increased demand is an interesting one, and we can have another webinar just on that. I mean, people, I often think through like what sort of recovery are we expecting, okay? It's quite clear to me we are not looking at a V-shaped recovery. It's probably a W-shaped recovery or a U-shaped recovery. Or, I heard the other day a term called the swoosh recovery, the Nike sign, like the economy falls like this and then it takes forever to come back. I think, to the answer to that question is yes, there's reduction in supply, but there's also reduction in demand. Okay, so because people will not have the disposable income in the immediate short term, right, to be able to splurge. And even if they do, they'll be more conservative in their spending. They'll save more. So we don't know yet, how the demand-supply gap will unfold. But the question is great because you absolutely have to expect a disruption in supply chains because the production to some extent, we hope it can be alleviated by this reduction in demand. So the gap is not massive, but maybe less than that.
Okay.
Okay, so
but we'll take it at the end. I just want to finish the time as well. But there are a lot of questions flowing in, which is great. Keep them coming. Thank you.
Okay, I'll just very quickly. I know we're short of time, so I'll just quickly say one other thing, which is, given the work that we've been doing in privacy, my own sort of recommendation and sort of projection here is we need really strong coordination going forward between the public and private sector. We have to give assurances to platforms and tech companies that they will not be, they will be exempt from adverse regulatory action. There'll be no private lawsuits coming after them. I mean, look, tech platforms have been going out of their way to help us. I mean, Facebook and Google have made a tremendous amount of data available to researchers and to the government. They're providing disease prevention maps in 30 countries. They're looking at aggregate location map data. They're providing us with people movement data, social networking data, right? I mean, these are the kinds of data that helps us understand how social distancing can get people to actually comply, right? So I believe, I think I see a world where you see more and more of this public-private collaboration. I also recognize that there are various data cultures around the world. And in some of the research that I'm doing now, I've been interested in comparing the privacy/data models across, let's say, the US versus China versus, let's say, Germany and South Korea. Okay? And they all have the pros and cons. I mean, our model might be a little too elitist, right? Because user data is generally presumed to be free by default for use by the private sector, right? In China, the approach is maybe a little too stringent. I find Germany's data protection anxiety to be just too technophobic for me. I think the assumption is that data is inherently dangerous. It needs protection. I don't see it that way, but that's how a lot of Europe works. And then in South Korea, I feel maybe it's a little too collectivist for us, right? Like we are not a collectivist society to the extent that the Far East is, right? So I think that's not to work. I think, frankly, I found Taiwan's hybrid information model to be a lot more compelling. Okay, it comes with participatory self-surveillance. In fact, there was a very nice article on this in the Bloomberg by Andreas Kloth. So take a look at that, if you get a chance. Basically, in the hybrid information collection model that is common now in these countries, it is a combination of Confucian democratic, okay? Because they place the public good above individual rights and privacy, but with the consent of the population. Why I feel we as Americans can get there is because our research, the one I mentioned at the very beginning, is in fact showing exactly that. On an average, we were willing to sacrifice some of our location privacy in return for allowing institutions to check for social distancing and contact tracing, okay? I feel we can actually mimic and imitate and get inspired by Taiwan's model. I expect to see more and more in the coming years to happen. So I think that's all I had for us today. If there's any remaining question, happy to take those. In the meantime, I hope you all stay safe, stay strong, and someday, sooner or later, I hope to meet you in person in one of NetElixir's fabulous conferences, if Udayan will have me back.
We would love to have you back on it. Some of the questions is about, thank you first of all for a fabulous, a very thought-provoking presentation. Some of the questions, I'll sort of narrate a couple of them.
Okay.
Unnati mentions that you made a great point about digital transformation for business resulting from the pandemic. Already food and grocery has moved to the curbside and delivery. Similar trends follow for health apps and virtual workouts as well. There are speculations about whether these shifts, both from the businesses and in consumer habits, are likely temporary or permanent. What is your take on these issues? Specifically, is the openness to sharing private information likely to last?
So the optimist in the Unnati believes that yes, this is not a fleeting thing that will just disappear. So I guess there's two parts to your question, right? One is, will our work habits or shopping habits change back to the norm to pre-COVID when things come back to normal? I don't think so. If you look at the data again coming out historically, we've seen 20 years of pandemics and 20 years of outcomes, right? At least for the flu pandemic, SARS, MERS, H1N1, Ebola, swine flu. Every time there's been a pandemic, there's been a fundamental shift in society. The one that I mentioned, with H1N1, with SARS in 2003, we saw the emergence of the e-commerce boom in China. I do believe that we're going to see, this trend continue, where people will continue to do more and more of online shopping, even after, let's say, some level of normalcy returns a couple of years from now. And I think with respect to openness of sharing private data, look, at this point we are seeing people willing to do so. I think if the long-term outcomes from this openness of sharing data are sustainable and proven to actually quantify it and measure, then I believe that people are more likely to see the benefits doing so, right? And like I said, one thing that needs to happen is, the private sector, public sector have to come together to make sure that, there are proper exemptions here. We also give assurances to companies to come forth and share the data. So a lot needs to happen, but I, remain optimistic on that front.
Fabulous. We'll probably sort of end with one last question, Anindya, because I know we have probably exceeded the time that we had stipulated, but some of the countries, we have a big group joining from India, and hello everyone. It's pretty late in the night there. I know it's beyond midnight there, so thank you for sort of staying up late. And one of the questions relevant to India is the lack of structured data, right? So in the situation that you're talking about, how can countries like India cope up, wherein the availability of structured data probably is much more limited compared to some of the countries that you had mentioned, like Taiwan or Korea and so on, Germany and so on.
Yeah, no, it's a great question. I think there's a lot of work to be done. I was recently invited to participate in some discussion with some of the political leaders, the establishment in India, and I'm realizing that a lot more work needs to be done. For starters, our data science and AI machinery, both at the private sector and the public sector, is easily 5 years behind, maybe more so than those countries whose examples I'm quoting. That said, what I found was a huge silver lining was the increasing cognizance of this limitation and the recognition that we need to do something with it. So I think, this pandemic is revealing, even in developed countries, there are major deficiencies in infrastructure building that's required. And I think, India is one of those countries which can get its act together, propel fast forward, because I do see more and more of this recognition and cognizance that we need to get this done. If, God forbid, if the pandemic unfolds in India the way it unfolded in the US, we have a disaster waiting to happen, right? The proximity of people, the density of people, the absence of adequate health medical infrastructure, we can't even fathom imagining what can happen. So I found that the politicians on both sides of the aisle actually, being more sort of cognizant, at least at least what they're saying in public. So I'm optimistic that in the next 2 to 3 years, we'll see more action on that front.
Fabulous. Anindya, thank you very much. So I'll just try to sum up. This has been quite fantastic, and thank you everyone for sort of joining in. A very thought-provoking presentation, as always, from Anindya. Some of the words to just sum up the entire presentation comes to my mind, Anindya. The first one I would think is, despite a lot of concern, understandably, and this is first and foremost a massive challenge purely in terms of health, safety, and everyone, right? But beyond that, I think from what you are mentioning, I think I can't really but think about the potential upside of this as well. So it's fair to say that the economy will not go back to where it is, or the world will not go back, but it will probably reset. And the reset actually may be more beautiful compared to what it was prior to that. The reason I'm using the word beautiful, despite knowing the conditions, and I don't really want to in any way dismissive of that, is primarily because I think any such situation or crisis forms to be a hotbed for innovation and new ideas and new way of working. As you have mentioned, Anindya, I think the digital transformation space has really expedited to a different level altogether. What does really the data privacy and how much should we really be bothered about, and how much and what is the implication of that? So I think it really opens up an infinite amount of possibilities for really fertile minds and fresh ideas to really be discussed and exchanged, which hopefully will reset it for a much stronger future as well. So I really wanted to thank you. I mean, we could have really continued a long time. As always, a fantastic presentation. Really appreciate you taking time to share the insights and data with all of our attendees. Thank you, everyone. Thanks a lot for joining in. And thank
Thanks
you.
for having me, Udayan. Thank you for having me.